Hey everyone, how's it going? My name is Eric Norman, and I'm a physical therapist here with Mettle, and I'm joined by, or I will be joined here shortly by my colleague and partner in this crime-fighting business, Christian Jorns, who's also a physical therapist. And today we're going to be talking about low back pain, one of the most common, if not the most common, orthopedic diagnosis that we'll see in practice, and very likely that someone listening right now has low back pain or has had low back pain. So we're hoping you're going to be able to connect pretty well with this podcast and hopefully get a good takeaway or two that either can help you out or you can help out someone you know. So anyways, thanks everyone for listening. And yet again, still no sponsor, but we'll get on that train here pretty soon, hopefully. All right. Hope you all enjoy. Thanks again for listening. See you later. Hey Christian, how's it going, man?
Hey, it's going pretty well. How you doing, Eric?
I'm doing all right. Doing all right. Just another long day in clinic today. How's your day?
Well, I was at a concert last night, so I didn't get the best sleep. So clinic
That's right.
day was a little rough, but I had my
Nice.
student finishing up her last day with so she did the heavy lifting for me while I kind of
Oh, right on.
just recovered a bit.
Nice. Right on, man. Would you go see for a concert?
Well, so I grew up in the classic like Midwest emo era, so I had to go see
I
a
get it.
band called Coheed and Cambria when they came to
Okay.
town. And then they actually weren't the headliner. The headliner was Primus, which is like they're a jam band. I didn't know them very well, but they actually put on a really cool show. So I had a good time.
Nice. Nice. Right on, dude. Right on. How's your training looking like nowadays?
Well, training's been a little bit sidelined, mainly because my family's coming to visit, my parents from
Oh
Illinois
yeah.
tomorrow, actually. So I've been in
Nice.
full Midwest dad mode. And my dad's a big lawn guy. You know the type, probably because you
Yep.
are one of them.
I
And
am, yeah.
I'm definitely not a lawn guy, but for some reason, my Midwest roots are coming through and I feel compelled to make my lawn and like home just look good. So I've been
Yeah.
up on the roof cleaning off pine needles, cleaned out my gutters, fixed up some siding that got damaged, did all the weed whacking, mowed the lawn, and I have a decent sized lawn that I choose to push mow.
Yeah. There you
So
go.
now
Look at
kind
that.
of tying in the training piece here.
Yeah.
Mowing my lawn is sneaky cardio. It takes me like 2.5 hours in total to push mow my whole lawn. I usually do it over 2 to 3 sessions. And I go pretty hard, so my heart rate will be at like 130 to 140 the whole time. I'm not really
Nice.
sure if that says uh, I'm working hard or if I'm really out of shape, but either way, job gets done and I'm getting my sneaky cardio.
Yeah. There you go, man. That's a great way to look at it. I like that. Yeah. I think there's something in the ACSM guidelines about how activity done at work can't be counted towards your, minutes of exercise per week. Like it has to be a dedicated 150 minutes or whatever of exercise per week and like dedicated towards that. Like you can't be like, oh, I had a really hard day at work lifting a bunch of lumber. Like you can't count that allegedly according to the guidelines, but I don't know, dude. I think that sounds like a pretty, on a hot summer day, sounds like a pretty kick-ass cardio workout to me.
Well, yeah, well, I think to your point about those guidelines, they like break it up by recreational work or activity versus occupational. And there seems to be something magical that happens between with people that do more recreational work. And it seems to be because they just have fun doing it. The
Yeah,
manual labor that you're doing at work just like doesn't have the same mental benefit. And so therefore it's less helpful.
yeah, yeah. That's a good point.
Well, what's your training update?
I've been getting back on the legs, man. I'm trying to say that without sounding like a total gym bro. But no, for real though, I've been getting back on that bandwagon. It's been good. It's been fun. And I'm not definitely as heavy as what I've gone in the past, but it's coming back around. It's been a while since I've had one of these, but I had one like 2 days ago where you wake up and like your first couple of steps, you can just feel it in like the hammies and the glutes, and you're like, oh, I had such a good workout yesterday. That was one of those mornings, and that made me genuinely pretty happy because I was like, damn, I haven't felt this in a long time. Um, so yeah, that was good. That was good to feel. But
Yeah, and once you've had that strength before, if you don't, wait forever between your training sessions, you're going to get it back so quickly.
yeah, absolutely. Yeah, yep. Yeah, absolutely. But yeah, man. So like we talked about in the intro, that tonight we're going to be talking about some low back pain, and we're going to present some patient stories and talk about some good takeaways and whatnot. So hopefully those listening or watching the podcast can come away with a point or two that they can take with them and hopefully benefit themselves or someone they know. So Christian, I think you said you got a pretty good story you like to talk about, so I'm going to let you get started with this one.
Sounds good. So I'm going to share a story about a 45-year-old patient with what I would consider pretty typical low back pain. Nothing crazy, nothing serious. It just hurts when he moves in certain ways. And the reason I want to share this story is because it'll help you all understand more about the power of imaging findings and the words that we use to describe those findings. And his story is something that I've heard many times over the years. And it's also something I can personally relate to because when I was in grad school, I had what I think was a lumbar disc herniation that caused like those classic signs of pain shooting down your leg and all that. All right, so 3 weeks before our first appointment with this guy, I got a message. He told me he was just diagnosed with severe degenerative disc disease and that he wanted to tell me all about what he's been doing since this diagnosis to make sure I was prepared for our first visit. And he got this diagnosis from a single x-ray and a single meeting with his primary care doctor. He told me that after getting this diagnosis, he stopped all forms of exercise, including going for walks. He stopped doing all heavy lifting, and the only lifting that he did was just what he had to do at a bare minimum to help take care of his family. And he stopped doing all these things because he was worried about causing more damage. He said, I'm really worried about what's going to happen to my back in the future. And he asked me a ton of questions like, what kind of lifting is safe to do? Will I ever be able to exercise again? I know I can't do this or that thing anymore, but what do you think about these alternatives? And big one, will I need surgery to get better? So clearly he's amped up, he's anxious. So I made sure to reply to him calmly and thoughtfully. But just before the reply, I wanted to make sure I had looked at that x-ray report from his radiologist. And the only thing that this report said was that he had degenerative disc disease at L5, S1. It also said that his disc height was normal, so it wasn't even like the disc disease was that progressive. There were no fractures, no stenosis, nothing serious whatsoever. So now on to my reply to him in this message. I replied to him by acknowledging his fears and pain, but also planting the seed that I don't see anything on his image that would prevent him from doing the things that he wanted to do long term. I said, I obviously can't give you definitive advice without meeting you, but this looks like something that we can totally work with and help you out with. I said, in general, degenerative disc disease does not mean that you can't lift again. It does not mean that you can't play sports again. And it certainly is not something we typically operate on unless you have other crazy symptoms going on. I did all the things that you can do through a message to try to calm him down and reassure him, and to convey the key message that you're not fragile and your back is resilient. So let's talk about why this story matters. Here's a guy who's living in absolute fear and ready to change his life entirely because he was told that his x-ray showed degenerative disc disease. The single finding was so powerful that it totally, completely, and immediately changed his behavior. The first thing you guys should know is that degenerative disc disease is so common. And because it's so common, most of the time, we consider it a normal part of the aging process, much like having gray hair or wrinkles. It really only matters if you have scary symptoms, like changes with going to the bathroom or worsening weakness in your legs, for example. His story also matters because it shows exactly why it's so important to set people's expectations. If I didn't know anything about degenerative disc disease and my doctor told me that mine was severe and they didn't tell me anything else about it, I would probably have some thoughts that I probably shouldn't be having.
Yeah, man. Yeah, no, I totally agree. Thanks for sharing that story. I'd be in the same boat. If I heard severe degenerative disc disease, like what kind of virus do I have going in my spine right now? Like, what is that? No, I totally agree, dude. And yeah, it's wild because that's a story that you'll hear from multiple therapists, right? And that like people are kind of losing their independence with what's meaningful because of words and pictures, right? I am wondering one thing though, just from your experience, you've been practicing longer than I have, and so you might have ran into this more, but you mentioned kind of those scary symptoms when it comes to low back pain. And you mentioned the difficulties with the bathroom, worsening, leg weakness, etc. How many patients have you ran into that have actually had those going on and you made a referral out to get them to proper care?
The exact number is 3. Now,
Okay.
I may have missed some, and I've been practicing for 8 years. So
Okay.
3 people over 8 years that I've referred out, and it was actually found that they had something scary, like cauda equina syndrome is one of the big ones that we look out for.
Hmm.
But out of, I don't know, thousands of people I've worked with now, it's not many.
Yeah. Right. Right. Yeah. And I know it's, I sometimes I think of it as like, like a hypochondriac, for example, like if you tell them like, hey, your back pain, it's okay, it's safe, it's pain, it sucks, but it's just pain. But if you experience these scary things, and then we want to know that so we can get you the right care. I've had an individual who I told that to, and they were so, obsessively analyzing everything that they were like, oh, I think my leg's getting weaker. I think like I'm getting more numbness. My inner thighs are starting to tingle. And it's like, okay, just to set the stage right, how many people, how prevalent are these red flags, etc., going on? Yeah, three out of thousands of people. That's a pretty low number.
Yep.
Awesome, man. Well, right
Yeah,
on. Thanks again for telling that story. Appreciate it.
of course. So now it's your turn. What's your story?
Yeah. Yeah. So I have, I'm sticking with low back pain too. The theme of the podcast. I have an individual, 67-year-old male who I've been seeing off and on for the last about 10 months. He previously pretty active individual. He loved his job. He was a teacher at a local elementary school, and he absolutely loved teaching children of the community, and kind of trying to brighten the future, so to speak, of the community here in Winona. And he just absolutely loved it. He started to get about 2 years ago, started to get some back pain that he noticed was starting to limit his ability to stand and walk and even like interact with the kids at school that he teaches, because the pain was getting to be so distracting. So he ended up going to his primary and got a x-ray done that showed some interesting things that led to them wanting to do an MRI. And it showed that he had multi-level degenerative changes throughout the lumbar spine to both the disc and facet joints. So I can't off the top of my head recall how many levels. It was, 2 or 3 levels throughout that lumbar spine, but it was on the MRI report. It did sound like, oh gosh, like it's more than just one level, etc. So it did seem, like a pretty serious thing of like, all right, this is like, these are some changes that are going on. And I kind of discussed the same thing with him that you mentioned, that, we term these things degenerative changes when a lot of the times it's just age related, right? As we age, things just don't quite work as well, do the same thing as what they did 40 years ago. That goes with, tissues in the body everywhere, and the spine and joints in the body are no different. And so that was one of the quick conversations I had with him. But kind of back to his story, was he actually ended up quitting his job as a teacher because he just couldn't couldn't do it anymore, which was sad for me to hear. He made that decision prior to coming to physical therapy. He actually, I remember in the eval, he started crying about it because it just meant so much to him. And he couldn't believe that he was at this point where he had to quit his job and really stop being active overall. He loved to hike, he loved to golf. Those were his two big things. And he stopped doing both of them in fear that he was like breaking his back because of these different changes. But no red flags for this individual. Red flags are, serious symptoms that we talked about earlier, but he did just overall have this significant fear of movement. He was afraid to bend. He was afraid to lift things. He was afraid to stand for too long because as the pain got worse, he associated this with, tissue being damaged in that low back. So what do we do about this? He was, right away, he was an individual that a lot of education on pain, a lot of discussions around red flags and kind of what needs immediate medical attention, what doesn't, what's safe, what might not be as safe, right? I remember talking to him being like, we maybe shouldn't go and try and dunk a basketball, but, you can shoot hoops every now and then. Like, there's definitely things where you can still be active, but don't go too crazy with it. We also discussed the 24-hour rule and about how, all right, when we do these exercises, or if you go for a hike, and if your pain or stiffness or lack of movement because of pain inhibiting it, whatever it might be, if that lasts for greater than 24 hours and it's inhibiting you, and then, all right, we might have done too much that prior day, just make note of that, and it's going to be okay. The pain will go down, and when we have a chance to do that again, just do it a little less. We also knew that rotation felt pretty good for him, and so we also just worked into rotation. Lumbar rotation, we started doing, like banded resistance stuff, just started out really light. I remember the first time he did a banded rotation of his trunk, he was like amazed of like, oh my God, I'm doing a movement that I would have thought would be damaging, but it's not. And just kind of introducing that entry point there, I think that really helped him with understanding, okay, what's safe and what feels good is okay to do. And then lastly, we also did some long axis distraction for just symptom modification, right? Because throughout all this, as he was able to gain more confidence and do more things, unfortunately, he was still having pain and discomfort. And we talk a lot about, what is safe and, what is still okay to do. But at the end of the day, this individual is still having pain and discomfort. We found out really early that long axis lumbar traction really helped this individual. We would do it for, 10, 15 minutes and he would feel better for the next day or two. And so, we were seeing him every week. So we were able to get a couple days out of the week where he was pretty pain free after doing it. And so that was good. So as much as we've been doing activities and promoting movement, it was also very appropriate that we did a little bit of manual therapy to symptom modify. And then lastly, the outcomes. Like I said, I've been seeing him on and off for 10 months. He's come back for 2 different episodes of care. I started seeing him last October, saw him for a couple of months, and it was, all right, you're good to go do your thing. And he'd come back for a couple more visits until it was, all right, you're good to go do your thing. And now he's back again. And it's not like it's a very, he comes back kind of more for like revamping of his home exercises, so to speak. He's, coming back to try and get an update with his home exercises and, kind of get a little bit more boost as to what he's doing at home. And really throughout this time, he's back to playing golf this summer now. He's been going for long walks, been able to do some hikes with his wife. He's actually now working 2 different jobs, not teaching, but he is back at work because he wants to be an active member of the community. And so he's back doing that. And he still has some low level pain, but it's all very manageable and he's back to doing a lot of meaningful things.
Dude, that's so good. That's like such a good case. That person had quite the journey where they gave up everything and then they found someone who convinced them that it was okay to work towards these goals again and that you're not doomed. You can do it. It's going to be a long journey, but but you can do it. And what I really liked about your story was how you nailed the foundational work. So you helped him understand his pain, just make some sense of it. You set his expectations about, look, your pain's kind of rough. It's not going to be gone in a week. This is going to take some time. It's a long road, like I said. And then you gave him some guidance on just what's okay to feel and what's not. And you just checked all the boxes of making sure someone is calm with this whole process. They understand what's about to happen and they feel like you have their back. You know what's going to happen. And I also really liked how you weren't against doing things that helped him feel better, like your long axis distraction, or it's sometimes called lumbar traction.
Yeah.
I know that that's a difficult conversation in like physical therapy, social media, where people are like, you really shouldn't be doing as much hands-on work. Don't do lumbar traction. And I totally get it. The research on lumbar traction, for example, is pretty clear that it doesn't provide any major long-term benefits. But for some folks, it can be really helpful to ease their pain. And the bottom line, too, is that you're doing the foundational work anyways. So now you're just adding on a little bit of extra to help them feel good and keep them moving.
Yeah. Yeah, exactly. And I totally agree with what you're saying. I'll be honest, he is one of, I mean, I think we all see a lot of low back pain individuals. It's the most common thing that we'll see in physical therapy, low back pain. But doing that type of manual therapy technique, I've only probably done on, 3-4 individuals throughout my time as a PT. So it's not like it's one of those things that you do a lot. But I also think you have to recognize that, like, man, this person is putting in so much like GD hard work right now. And if it's just placebo of like every time he lays down and he gets a little pull at the, on his legs, he's just like, oh, this feels so good. It's like, dude, you've earned it, and if that's what you want at the end of a session, and then that's what you get. So no, I totally agree with what you're saying though. It is kind of it's a weird like taboo thing of like, I don't know, for some reason being passive is looked at as a negative thing, I guess. And I think in some situations it definitely has its time to treat.
Yeah, I think it's one of those things too where the pendulum just swings so hard one direction to the next. Like 1 minute, everyone's learning manual techniques. Next minute, they're the worst thing in the world. Everything has to be active. Don't touch anyone. And then you eventually just meet somewhere in the middle where you're like, okay, there's a lot of nuance here. Everyone is going to be trying to do more active-based therapies, of course. That's generally the best. But we can always layer on these extra things like manipulations or adjustments from a chiropractor. Traction, massage, all that stuff does have a place.
Yeah. Yep. Absolutely. I couldn't agree more. And also, I just want to say, if you're hearing some weird creaking in the background, it's because there's a train going by my house. So
I haven't heard it.
Okay. All right. For the listeners out there, if you're hearing something weird in the background, it's because there's a dang train going by. All right. Anyways, so for me, my big takeaways from my patient case, majority of low back pain, we know that a high percentage of low back pain, specifically somewhere in the range of like 70 to 90%, it's going to go away within a 1 year timeline. And so what should we think about this is that we have a promising or a favorable outcome when it comes to treating low back pain. And that's something I think is missed when it comes to, patient education in terms of, hey, your back pain, it's not fun right now, but there is a good prognosis for you in the fact that 70 to 90% of acute low back pain, which is probably good to differentiate between, chronic, long-standing low back pain and acute low back pain. Acute low back pain will be better within 1 year time. But we also know that back pain is reoccurring, just like neck pain, that once you get it once, there's a chance that even if we get you feeling 95% better, 2 or 3 years from now, you might have a flare-up come on that might last for a little bit, right? And so I really like, and this is my last point I'm going to make, is I remember when I was reading the orthopedic monograph when studying for the OCS, that in the lumbar spine section, they talk about how maybe we need to reframe our mindset around treating low back pain, not as much as we're trying to provide a cure, but as more that we're giving individuals these maintenance programs about being able to stay active and get back to what they want to do versus giving them an outright cure for their low back pain. And I think that when you change your mindset around that, when you're treating individuals, it creates kind of a shift in how you approach working with them. That I'm not trying to cure you. I'm just trying to make you better so that you can live with this low back pain, because we know that over time it's going to get better for you. So, or at least very, very likely it's going to get better for you. So, those are my takeaways. Rather than thinking of low back pain as a cure-all treatment, maybe we need to start thinking of it more as a maintenance program for when people have flare-ups.
Absolutely. Yeah, I think shifting the focus from cure more to management is like the more appropriate way to talk about it. Look, everyone wants a cure. No one wants to have low back pain ever again. It's awful.
Right.
But flare-ups are normal. I know when I had what I think again was a disc herniation, there were like 3 years where I would have a couple flare-ups a year. And they'd be like, I'd be incapacitated for 24 hours, just lying on my back, just cannot move. But then I just kept working, trying to get stronger, to keep moving different ways. And I haven't had a severe flare-up in like 6 years.
Nice.
Yeah, things are going pretty good.
Yeah.
Now, so to my story, and like a big takeaway that I'm trying to share is, if you're anything like the patient in my story, the first thing I want to say is that it's not your fault that you are kind of scared or worried or just don't know what's going on. We need to do a better job of setting your expectations. We need to guide you better so that you don't make drastic life changes for no reason. And the most important thing that I tell my patients with low back pain, and I'm sure you tell them the same thing, is that I want you to keep doing all the things that you like or need to do in your life to the best of your ability. Don't just stop doing stuff. That in itself is honestly one of the most powerful treatments that we have. And that exact advice comes from the world's leading low back pain researchers. Like, we're not just here making this up. And then second, when you're told that you have whatever finding on whatever image, ask your provider or even several providers at least this one question. What does this imaging finding mean, and how confident are you that it matters?
I love that. Yeah, I think I just want to go back to what you just said there is, what does this mean and how much does it matter? Because a lot of times it's not uncommon for our brains to go to worst case scenario and, think about, oh my God, what kind of road am I about to go down here? So yeah, I really like that last takeaway there. And, no, I mean, I would agree. I think that as physical therapists, we have such an important role as just almost as, showing individuals about what they can do rather than trying to teach them something new, kind of like how you were alluding to there of whatever most important to you, do that to the best of your ability. And you're right. What we're talking about is not, we just didn't have a phone call before this and make this stuff up. This is well researched stuff. From leading physical and physiotherapists across the country and across the world. So it's great stuff for sure.
Yep, absolutely. Well, did you have any last minute takeaway key points for people?
Just do as many deadlifts as you can. I think that's the best preventative medicine. Just deadlift your heart away.
I will say, so I know that that's like a joke and we don't really have strong evidence for that.
Yeah.
This is totally me, like, not talking as a physical therapist, just talking as myself and my bias. I'm pretty confident that starting deadlifting when I had that bad low back pain is actually what got me out of it. Like, I felt so much better as my deadlift got stronger. It could have just been timing, could have been natural history. I don't know. All I know is it worked. And I still deadlift and I feel great.
What's the saying that anecdotal evidence is the best evidence? Is that?
Sure.
I'm just kidding. Dude, no, yeah. I think, I don't know, man. Maybe there's something to it. Maybe just put some weights on a barbell and pick it up. No, I'm just kidding. No. I think overall I think we gave people a lot of good a lot of good advice and evidence-based advice that they can go on and, hopefully use that for helping themselves out or help out an individual that might be struggling with low back pain.
Absolutely. And there's more to
But
come.
absolutely. All right. Well, thanks everyone for joining and listening, and we'll be back next week with another podcast discussing who knows what. We'll figure it out, but it'll be another joint that we'll be discussing. So, all right, Christian, thanks so much.
All right, later, Eric.
See ya.